John, thanks for joining us here on the programme this morning. Does this mean that the virus is airborne?
It certainly does. I was one of the 239 scientists that wrote the open letter urging the World Health Organization to recognize aerosol transmission over a month ago. There is evidence being built in the literature over the last months. And I think this study really nails it home now, that the fact that this aerosol, that aerosols, I mean, when we're talking about aerosols, these are tiny particles smaller than droplets. And because of that, they can travel in several meters across a room. And actually, if the room is not ventilated, for example, the concentration of the virus-containing aerosol can build up. And this means that exposure is not just within the 2-meter range, it could be at room level. And I think this study really now goes to show that it's not just present at more than 2 meters, it's also infectious there as well.
Okay, this, as I mentioned, is data research carried out by scientists at the University of Florida in the US, and the findings that were posted online haven't been vetted by peer reviews effectively, but they are causing a bit of a stir among scientists and even the likes of yourself, John. How much of a concern is this, though?
Just a word about the study itself. We have been able to measure the virus in air before, but not really to show that it's infectious. The measurements are very difficult to do, and that's part of what we do as atmospheric scientists. We measure aerosols too. But these researchers used a very smart technique to collect the aerosol and maintain its integrity, and then demonstrate that they could infect other cells. And so that was a really important breakthrough. And I think that research really needs to push forward to identify the different ways of transmitting the virus, because this informs the measures that we can put in place to stop its spread. You know, we've heard about distancing, hygiene, but what this means also now, I think, is masks. Obviously, now masks have become more widely accepted already. I think that has been taken on board. But really, the important additional measure is ventilation. And that hasn't been talked about enough, really. Just simply, if you're in a small room with many people in it, obviously, even with distancing, we could build up a concentration of virus if one person is infected. And we need to make sure that we clean the air, not just clean the surfaces. If we clean the air of the virus, then we're reducing risk of transmission. And the way to do that is through ventilation.
So ventilation is key here. Are you talking about things like opening windows?
Simple things like opening doors, opening windows to clear the air. And I'm really mindful of this now, especially as schools are going back in a couple of weeks' time. When I looked at the Department of Education guidelines, I was really dismayed to see that there was lots of talk about cleaning, but only of surfaces. There wasn't any talk about cleaning of air. Very little mention of the fact that simply opening doors and windows, allowing more outside time for children, and I think that's going to be important now if they're going to be wearing masks a lot. That was hardly mentioned at all.